All right, now we're going to move on to type 2 diabetes. And it's important that we understand this because in lesson 5, we're going to talk about a lot of the associated health risks of type 2 diabetes. And so this will lay the foundation for lesson 5. And we're going to go over the next several slides here. We're going to talk about various terms you should know when working with clients and just know in general. First is, what is insulin resistance? It's a condition, we've talked about it before, it's a condition when the cells of the body become resistant to the effects of insulin. That is, the normal response to a given amount of insulin is reduced. So what happens is the pancreas has to release more insulin in order to get the same effects. This resistance is seen in the body's own insulin, endogenous, and also if you give it exogenously as well. So if they're insulin resistant, it doesn't matter if the insulin is coming from the endogenous, from the pancreas itself, or exogenous from shots. Either way, the body is resistant to the effects of insulin. Well, when someone becomes insulin resistant, they usually have, at least initially, hyperinsulinemia, which means the amount of insulin in the person's blood is higher than normal, and it's usually associated with one part of the type 2 diabetes. Usually it's going to be a sign of some underlying problem controlling blood sugar, where your pancreas has to secrete a large amounts of insulin in order to keep your blood sugar within normal range. Again, hyperinsulinemia may be caused by insulin resistance, where your body is resistant to the effects of insulin. It may also eventually lead to the development of type 2 diabetes, when your pancreas is no longer able to secrete the large amounts of insulin. So usually what happens is, in the early phase of, as you move, we talked about, it takes about 10 years for someone to develop type 2 diabetes. Usually in the early phase of type 2 diabetes, or as you move closer to being type 2 diabetic, you have hyperinsulinemia is usually one of the things that occurs early on in order to get your blood sugar, keep your blood sugar in normal levels. So your pancreas has to work really, really hard in order to get your keep your blood sugar within normal levels. However, the effects of elevated insulin on type 2 diabetes can be negative long term. Increases of fasting blood glucose results in an increase in the fasting plasma insulin. So in other words, as your blood glucose levels continue to rise, your pancreas has to work even harder to keep your blood sugar within normal values. If your blood glucose level of 140 will result in a decline in fasting insulin levels, meaning that your pancreas just can't keep up with that amount. It has to work so hard it starts to exhaust itself. Imagine going from like a slow walk to now like a jog, for example. And then when your blood sugar goes above 200 milligrams per deciliter continuously, your pancreas just wears out. It's like trying to sprint. You can only sprint so much before you just fatigue out and you can't do it anymore. So that's kind of the similar of what's happening with your pancreas, that at 200 milligrams per deciliter of your blood sugar, your pancreas has to work so hard, it's like sprinting. It can only do that for so long before it paralyzes. Now your question is, can this be reversed? Absolutely. We'll learn in lesson 5 how if you start to reverse the process of the things that cause the development of type 2 diabetes, that you can start to reboot the pancreas in terms of releasing insulin again. So later on, once you start hyperinsulinemia and your pancreas starts to wear out, you start to lose or decrease the amount of insulin in your blood. Well, if there's no insulin in your blood to keep your blood sugar down anymore, you develop what's called hyperglycemia, which is high blood sugar. It's often found again in diabetes mellitus. It occurs when the body does not have enough insulin or cannot use the insulin it does have to basically move glucose from the blood and into the tissues to use for energy. Again, the signs of hyperglycemia are polydipsia, great increased thirst, polyuria, a need to urinate, or dry mouth. All these are caused by due to hyperglycemia, as your kidneys have to work extra hard to remove glucose from the body because your insulin is not able to do it. And the reason you start to develop great thirst is because your kidneys are using more more water to remove glucose from the blood. So you're peeing a lot, and you're also, because you're peeing a lot, you're using a lot of water, you're using and losing a lot of water, so you have a great thirst, and therefore you have dry mouth. So these are some signs and symptoms of individuals that would potentially have diabetes as well. So if you're working with a client, they start to develop these types of symptoms, it could be an indication they're developing type 2 diabetes. Again, so type 2 diabetes is just a term, used to be called adult onset or non-insulin dependent diabetes. But we know now that as more children are developing obesity, they're developing diabetes as well. So the term now is type 2 diabetes. And usually it's a chronic condition that affects the way that the body breaks down sugar. And when the person has type 2 diabetes, they're resistant to the effects of insulin at the skeletal muscle and liver, and the hormone that regulates the movement of sugar into the cell, insulin, is either not produced enough, or the effects at the tissue are diminished. If left untreated, the consequences of type 2 diabetes can be life-threatening, as we'll see in this video and we've talked about before with all the development of opathies, neuropathy, retinopathy, nephropathy. So let's go to pause here, and we're going to do a little bit of an overview. We have a series of videos that are going to give an overview of what type 2 diabetes is. I know there's a number of videos that they're a little bit redundant, but again, they're going to drive home the point of why type 2 diabetes is so important to try to prevent and or treat, especially as we're going to learn in lesson 5, all the health ramifications that it can cause throughout the body. All right, so this is the first of a few videos that we're going to talk about, the understanding type 2 diabetes.
Understanding type 2 diabetes. Type 2 diabetes is a metabolic disorder that causes sugar in the form of glucose to accumulate in the blood rather than being used as fuel by the cells in our body. When we eat, food is broken down by our digestive system into nutrient molecules that are then absorbed through our digestive tract for use by the body. Foods containing carbohydrates or various sugars are broken down into glucose. Glucose is an important source of fuel for many organs in our body. However, to be able to use the glucose for fuel, the glucose molecule must first enter into the cell. The pancreas produces a hormone called insulin, a chemical messenger essential for the entry of glucose into cells. As the blood glucose levels rise after a meal, insulin is released into the bloodstream and sets processes in motion to trigger the removal of glucose from the blood to enter into the cells. In type 2 diabetes, the cells become resistant to insulin and ignore its message to absorb glucose. This is known as insulin resistance. In addition, in type 2 diabetes, the pancreas is unable to produce the greater amounts of insulin needed to trigger these resistant cells to take in glucose from the bloodstream. The most notable symptom of diabetes is frequent urination and excessive thirst. Other symptoms include weakness, drowsiness, and blurred vision. These are caused by chemical imbalances in the blood related to high levels of blood glucose. About 1 in 4 people with type 2 diabetes are unaware that they have the disease. It is important to catch diabetes early. Over time, high blood glucose damages the blood vessels, which can damage the organs that these vessels supply, leading to a variety of health complications. Damage to the small or micro blood vessels can cause vision problems, including loss of sight, nerve damage, and kidney disease. Damage to larger or macro blood vessels can lead to cardiovascular complications such as heart disease, stroke, and poor blood circulation. Overweight and inactivity are major causes of diabetes. A family history of diabetes significantly increases your risk of developing the disease. Certain ethnic populations are also at increased risk of developing type 2 diabetes. Finally, some medications may increase your diabetes risk, specifically corticosteroids, thiazide diuretics, drugs used to treat certain mental illnesses, and some antiretrovirals used to treat HIV infection. In summary, type 2 diabetes is a metabolic disorder. It causes sugar in the form of glucose to accumulate in the blood rather than being used as fuel for the cells in our body. If not diagnosed and treated in a timely manner, type 2 diabetes can lead to many health complications.
All right, so that was one of the videos that kind of set the stage of what type 2 diabetes and the problems that are associated with it. We have a few other videos that kind of give a little bit more details about the diseases that are associated with it. And then we have a case study about what type 2 diabetes can do to somebody. All right, so this next video details a little bit more ideas about what diabetes does to us. It's a little bit blurry, so try to bear with it, but it'll give a good overview of diabetes.
Hello, I'm Dr. Lauren Stryker. Diabetes is a serious disease affecting millions of people in the U.S. today. Both type 1 and type 2 diabetes cause abnormally elevated levels of sugar in the blood when we eat. Because diabetes is a disorder in the way the body metabolizes food, let's look first at the process of digestion and how it normally works. During and immediately after a meal, our body begins to break down food molecules, including carbohydrates, into sugar molecules, one of which is glucose. Glucose is a simple sugar that provides the fuel that every cell in your body needs to survive. After we eat, glucose is absorbed directly into the bloodstream, and our blood sugar levels rise sharply. This sends a signal to the beta cells of the pancreas, instructing them to secrete just the right amount of insulin to manage the sugar. Insulin enters the bloodstream, rising to peak levels within 10 minutes of eating. Its task is to facilitate the entry of glucose into the body's cells, particularly the cells of the muscles and liver. There, glucose is either used to power the cell's activities or it is stored for future use. Once blood glucose levels are at their maximum, the pancreas slows down insulin production. The liver plays an important role in this process as well, storing excess glucose until the body needs more energy. It's a wonderful balancing act. In the case of type 1 diabetes, the pancreas does not produce enough insulin. And in type 2 diabetes, the pancreas may produce enough insulin, but the cells of the body have become resistant to its effects. They have become insulin resistant and cannot absorb the glucose they need. In both cases, glucose is unable to get into the cells to do its work. It remains in the bloodstream, building up to dangerously high concentrations, a condition known as hyperglycemia. Because the body cannot use the excess glucose, it spills over into the urine and is lost. As a result, the body's cells are deprived of the fuel they need in order to function and survive. Most likely, the person will experience extreme hunger and thirst, weakness, and weight loss. This concentration of glucose in the bloodstream has a number of potentially devastating consequences in the body, from the head down to the toes. Most at risk are your heart, nerves, kidneys, and eyes. Let's look at some of the most common and dangerous complications. The primary cause of death among people with type 2 diabetes is cardiovascular disease. High blood sugar can damage blood vessels and coronary arteries. Diabetics are at greater risk for developing arteriosclerotic plaque, which narrows the blood vessels, increasing the risk of heart attacks and stroke. Additionally, people with diabetes also have a diminished ability to heal wounds. This occurs for several reasons, but the two most important are a reduced ability of white cells in the bloodstream to remove bacteria and a reduction in the amount of oxygen delivered to the wound. Because of this, diabetics are at a higher risk for developing serious infections and generally will require a significantly longer time to heal. Over time, high blood sugar levels can cause nerve damage or neuropathy. This damage makes it difficult for the nerves to carry messages to the brain and other parts of the body. The result is a loss of feeling or a painful tingling sensation in parts of the body, most commonly in the feet. This means diabetics are at a higher risk for injuries which frequently go unnoticed and can become infected. High levels of blood glucose increase the risk that diabetics will develop kidney disease, known as nephropathy, a serious condition in which the kidneys are unable to rid the body of wastes. Diabetes is the leading cause of kidney disease, accounting for nearly 45% of all new cases. In the eyes, diabetes can lead to a number of complications. The most common and most serious of these is retinopathy. High blood sugar can damage your retina, the tissue at the back of your eyes that captures light and relays information to your brain. Nearly half of all people with diabetes have some degree of retinopathy. The longer you have diabetes, the more likely it is you'll develop this condition. In general, the best way to prevent much of the damage that can occur with diabetes is to stick to a healthy diet and exercise plan. It's also important that you maintain your drug regimen as prescribed by your doctor. Now that you know how diabetes affects the body, you can learn more about the methods of controlling this disease in our How Do I Control It chapter. Thanks for watching.
All right, so that was a video that talked a little bit more about the opathies, neuropathy, nephropathy, retinopathy. So again, neuropathy is the effect on the nerves, retinopathy is on the eyes, and nephropathy is on the kidneys. So this hopefully gave you a little bit of a better understanding of each. And now we're going to move on to the final video about a case study of an individual who's suffering from type 2 diabetes. All right, so this is a video of a case study of an individual suffering from type 2 diabetes. So pay close attention to how the person is diagnosed and their treatment as they move through.
A 45-year-old obese woman comes into the office complaining of increased thirst and frequent urination. She has a history of poor dietary intake, a sedentary lifestyle, frequent blurred vision, and a problem with a chronic yeast infection. Her doctor asks for her family's medical history. She explains that her 67-year-old father has a recent history of stroke and has been a type 2 diabetic for over 15 years. In light of her medical and family history, her doctor suspects type 2 diabetes. In type 2 diabetes, insulin receptors become resistant to insulin. Fewer glucose protein transporters are activated, decreasing glucose uptake into cells. The pancreas must then upregulate insulin production to import glucose more effectively. Over time, the pancreas becomes less efficient at upregulation of insulin, and plasma glucose levels rise. The doctor tests her blood glucose levels and determines that her A1C is 8%, which indicates type 2 diabetes. An A1C of 6.5% or higher is needed to diagnose diabetes. The lab results also showed sugar in her urine, which is abnormal. Her doctor explains that her increased thirst and frequent urination are because of her elevated blood sugar. Her kidneys must filter out more sugar from the bloodstream, creating more urine and causing her dehydration. Her accommodation problems are triggered by osmotic and fluid changes in the lens of her eye that cause the lens to swell. Her vision should return to normal within 3 months as her blood sugar normalizes. The excess sugar in her blood also caused increased glucose in vaginal secretions. This creates a nutrient-rich environment for yeast to grow and can explain her chronic yeast infection. Type 2 diabetes is controlled by healthy eating habits and exercise. Medications may also be able to control blood sugar levels. Eye and foot evaluations, as well as appropriate immunizations, will further enhance the effectiveness of type 2 diabetes control. Management of type 2 diabetes starts with the patient and is maintained by the doctor in efforts to return the patient to his or her everyday routine.
All right, so that was a series of videos that gives an overview of what type 2 diabetes is and also a case study. So make sure you have a good understanding of these and review these to give you a basis for which type 2 diabetes develops and what it can do for us, to us. Again, just to review, we have insulin resistance and impaired beta cell function. So here's just what happens with kind of the continuation or the progression towards type 2 diabetes. If you have insulin resistance, you can, if you have normal beta cell function, what's happening here is you have compensatory hyperinsulinemia, which means that your beta cells, your pancreas, is able to keep up with the rising glucose levels, and therefore you have normal glycemia. That's usually what happens initially in the earlier stages as someone starts to develop insulin resistance. However, over time, if left untreated, they start to have abnormal beta cell function as the pancreas starts to wear out. You start to have relative insulin deficiency because the pancreas just can't keep up with the rising blood glucose levels. Therefore, as insulin levels starts to drop, as the pancreas starts to wear out, your hyperglycemia, high blood sugar starts to set in. And eventually, if left untreated, hyperglycemia over the long term can develop into type 2 diabetes. So again, you have the early stage of the development of insulin resistance, where your beta cell is able to keep up with hyperinsulinemia to keep your glucose within normal range. However, over time, if left untreated, you start to have abnormal beta cell function where insulin is not released efficiently enough, and therefore there's low amount of insulin in your body and therefore in your blood, and therefore you have hyperglycemia and type 2 diabetes. So this is the earlier phase of insulin resistance and then the later phase of insulin resistance as it starts to move on to hyperglycemia and type 2 diabetes. Here's an illustration. Again, we talked about how it takes about 10 years or so for someone to move from being healthier to a type 2 diabetic. So again, if you're working with someone and they said they've been recently diagnosed with type 2 diabetes, just remember that it's taken about 10 years for them to develop. And this just shows about the beta cell functioning, how 10 years prior to diagnosis here where the arrow is, it was about 100% functioning, but over those years, it started to decrease the functioning of it. And again, if left, then here they're diagnosed with type 2 diabetes at this dotted line, and then if left untreated, it's going to continue to get worse and worse in terms of the beta cell functioning and its ability to release insulin. So here's, again, just a slide that illustrates the underlying cause of type 2 diabetes, kind of summarizing what we talked about, where you have an obesity, someone suffering from obesity, that's going to cause insulin resistance throughout the tissue, and we'll talk more about that in lesson number 5, what that means. But as they become insulin resistant, the beta cells are going to increase insulin release into the blood. Well, that's going to cause hyperinsulinemia, high insulin levels. The idea is to help keep blood sugar at normal levels. However, if left untreated, you're going to have impaired glucose tolerance, which basically means they're going to have prediabetes. When they have prediabetes, the blood sugar is going to continue to rise. The beta cell is going to try to keep up with releasing insulin, but it starts to wear out as it can't keep up with the rise in glucose levels. Therefore, you're going to have a decrease in insulin secretion. Without insulin, that's going to cause a rise in blood sugar. And this is usually the early onset of type 2 diabetes. Eventually, beta cell failure with a continued elevation of blood glucose is going to cause the beta cell to wear out and stop producing insulin altogether, and you have late or full-blown type 2 diabetes. And again, can this be reversed? Certainly, it can be reversed in terms of regaining the pancreas' ability to produce insulin, but you'd have to address the underlying cause of obesity and insulin resistance through diet, exercise, in some cases medication. Again, we're going to talk more about this in lesson number 5. So here's just a summary of the development of type 2 diabetes. Over time, the pancreas is producing so much insulin in order to keep blood sugar levels within normal range that it begins to wear out. And when it does wear out, less insulin is produced and secreted into the blood. Thus, blood glucose levels rise, called hyperglycemia, and there is less insulin in the blood to remove glucose, and eventually the person develops type 2 diabetes. Again, we're going to talk more about the ramifications and lesson number 5 about type 2 diabetes. But just make sure that you have a good understanding of this before you move further on.